All right, my name is Riley, and this is my assignment for seminar about advice from a year three student. So my name is Riley, and I completed my externship at Randall Children's Hospital in Portland. I mainly worked with pediatric patients, but I also saw a handful of hospital employees and adults with disabilities. I gained experience in diagnostics, hearing aids, cochlear implants, bone conduction devices, sedated and non-sedated ABRs, newborn hearing screenings, and of course, counseling with families and working with multidisciplinary teams. Some ways that I've grown, I would say one of my biggest areas of growth was my confidence. I became much more comfortable making decisions and trusting my judgment. I grew from needing a lot of guidance to being much more independent during the appointments. And my critical thinking also improved as I encountered more unique and complex cases throughout the year. I learned how to manage appointments more efficiently, and because pediatric audiology can be so unpredictable, I also became much more adaptable when things did not go according to plan. Professionally, I would say that I grew in my confidence communicating with families, preceptors, and other healthcare providers. My report writing got better over time, and I, of course, learned how important it is to be on time, prepared, and dependable, so that you're always ready to lend a hand when needed, which is especially important in pediatric hearing evaluations because sometimes you will need to be that extra pair of hands to help complete that test with the kid. And I also learned how to take accountability for my mistakes and use feedback as an opportunity to improve. And overall, I just became more comfortable functioning as part of a larger team with my preceptors, other students, and other healthcare providers. My biggest piece of advice before you guys go out to externship would be to take initiative whenever possible, volunteering to help, asking to observe new things, and always looking for opportunities to learn. Being open to feedback, don't be afraid to ask questions. Your preceptors really want you to grow and want to help you do that. And so asking questions shows that you're engaged and eager to learn from them. In the middle, I wrote work-life balance is key, which I think is definitely a priority as you begin this last year of school. Externship can be really demanding, and taking care of yourself outside of clinic is especially important to prevent burnout and staying motivated throughout the year. Take some time to build relationships with your team, your preceptors, coworkers, front staff, other students, or just anybody you are around in your setting. And because some of the best learning opportunities come from the people around you, and they can really be your support system when times get hard. And if you're lacking confidence at first, that's okay. That's completely normal and pretty much given as an extern and as still a student learning. Confidence will come with repetition, experience, and seeing more patients over time. And with that, I would say don't be afraid to challenge yourself and put yourself in situations that are uncomfortable and you don't feel fully prepared, because that's when you will have to figure it out and you will learn how to gain those skills. So, some information about my experience working at Randall's. Um, One mistake that I have been working on since I fully acknowledged it was that I often focus too much on talking and filling silence during counseling appointments. I would feel like I would talk too much or too quickly instead of giving families some time to process the information. And I learned through some great advice from my preceptors and from some patients who, um, asked for that time to process. That listening can be just as important as talking, and being comfortable with silence made me a better counselor. And so while I was really uncomfortable with it first, and I felt like I needed to fill in all the space because if I didn't, then they would think I didn't know what I was talking about. Being okay with that silence helped me create more meaningful conversations with families, and they were able to process information better. One of my favorite memories from externship was following a patient from their very first initial hearing loss diagnosis all the way through the cochlear implant process. I was able to see them during their evaluations, the surgery, the activation, and the follow-up visits. And watching their progress over time was really rewarding, as well as getting to know the family and to help with counseling and different evaluations and building that relationship. And it really showed me the long-term impact that audiologists can have on patients and families. And truly, that experience reminded me why I chose and why I love audiology so much. Some final words of advice before I leave. Um, First and foremost is to give yourself grace. Everyone will struggle at some point during externship, and that's normal and part of the learning process. Um, Focus on getting better each day instead of expecting perfection right away. Small improvements will add up quickly over the course of a year, and before you know it, you will be a fully independent audiologist. Stay organized, ask questions, and be open to feedback. These habits will help you grow more than just trying to learn everything from the start. And it is also a very great skill to learn as you enter your first job. And most importantly, remember that you are probably more prepared than you think you are. Trust your training, trust the process, and don't be afraid to challenge yourself. We've been prepared very well by the people at Pacific, and so leaning on their um, advice and their guidance is really helpful. And good luck and enjoy the experience. Externship will go by a lot quicker than you think it will. And congratulations for making it to your third year.